We were hoping for numbers to settle down already after that slight increase. But unfortunately, we will see here that by the middle of February, we were starting to report cases in the 2,000s, 4,000s, 8,000s, and now it's about 12,000 a day. And so if you think back to the previous slide where I mentioned that it might not be surprising for our numbers to reach 1 million very soon, I think you will understand that this can be a very realistic projection. Now, the top part of this table shows us the leading contributors in terms of cases ever since documentation was started for COVID-19 disease. And the top regions, the top provinces and cities have hardly changed. The epicenter of the pandemic for the Philippines has always been the NCR, and it's spilled over to nearby regions contiguous to NCR, such as Region 3 and Region 4A. The Visayas region is also an entry point to the southern part of the Philippines, and it's not surprising that many cases are also being registered from that area. However, what has been new, a new finding is really cases being reported from regions that we thought were actually not very much affected initially by the COVID pandemic. For example, the Cordillera Autonomous Region seems fairly remote, and yet we have an explosion of cases there. And when you look at Quezon City, Manila, Cavite, and Rizal, which have always been part of the list, now you see a city like, or a province like Bulacan, which is also reporting an increase in the number of cases. Now, in the list of cases that I showed earlier, or rather in the number of cases I showed earlier, the 800,000 plus is actually the total cumulative positive cases since we started reporting. We actually want to focus on how many cases are currently active and what the distribution is like for those active cases. Now, I'd like to show you first the breakdown of the current active cases nationwide. And here you will see that the majority, 97.6%, are mild, followed by the asymptomatics at 1.2%, followed by severe critical, each at 0.5%, and finally, moderate at 0.3%. So if we use the current active cases number from NCR, which is about 93,000, we expect that the majority of our cases who are active now should fall within the mild category at 91,401. Moderate plus severe plus critical should number about 1,200, and we should have about 1,000 or so asymptomatic cases. With that, why is it then that our occupancy rate for hospital care is so challenged? You will see here that if you put together those facilities which are reporting moderate, high, or critical risk, they compose the majority of the 159 facilities that are present in the NCR. Although there are 62 facilities that are reporting that they are less than 60% occupied, putting this all together, this still comprises the majority of the healthcare facilities in the NCR that have no more room to accept any more patients. And so, I hope I've been able to build a case for you to say that because the healthcare capacity is extremely challenged, and because the majority of cases are expected to be mild, home care needs to be an option for our family members or for people we know who have suspected or confirmed COVID-19. Now, the WHO has recognized that many settings worldwide actually will have very limited capacity for facility-based care. And as early as March of 2020, they already started coming out with guidelines for home care of this category of patients suspected or confirmed with mild disease, and the management of their contacts. So they said that home care can be considered when inpatient care is unavailable or unsafe. So that is certainly currently the situation for us here in the Philippines. Even if you had the resources to be admitted, there is simply no more room available in many of the healthcare facilities to accommodate individuals who need facility care. Now, the decision as to whether somebody needs to be cared for at home actually depends on three important factors. First, the clinical evaluation of the COVID patient. Second, the evaluation of the home setting. And finally, an evaluation of the ability of caregivers to monitor people with COVID in the home setting. So I'd like to translate these three factors to questions that we can easily understand. First, we need to answer, does the patient qualify for home care? Next, we need to check whether the home setup is appropriate. And finally, we need to check whether the caregivers can assess the patient adequately. And so we'll answer each of these questions in turn. And I hope I'll give you a little food for thought so that this becomes a springboard for the questions that you will be posing later during the Q&A. So let's try to answer the first question. Does the patient qualify for home care? So the WHO guidance tells us that it is those patients who are asymptomatic or those with mild or moderate disease without risk factors for poor outcome who will qualify for home care. So when we talk about mild or moderate disease, what exactly do we mean? We cannot, or rather, the criteria that we want to see first includes the absence of difficulty in breathing. The patient needs to be comfortable breathing just room air and does not have any shortness of breath. How is that described? That means when somebody is speaking, they can speak in full sentences very comfortably. Hindi sila hinihingal, hindi sila hinahapo. They don't catch their breath when they speak. If you have the opportunity to count their respiratory rates, and particularly for adults, because most of the COVID patients are actually adults or elderly, the respiratory rate should be less than 30 breaths per minute at rest. And if you have the opportunity to measure their oxygen saturation, because many of us now might have pulse oximeter devices in the home, the oxygen saturation on room air, meaning without any oxygen supplementation, should be at least 94%. So it can be better than 94, but it should not be lower than 94%. So you need to fulfill these criteria before you can say that somebody even qualifies for home care, because they can be categorized as mild COVID. Another thing we need to look at is whether or not they have risk factors. So here are the risk factors for poor outcome. If they are above 60 years old, they are smokers, they are obese, or they have non-communicable diseases like cardiovascular disease, diabetes, chronic lung disease, chronic kidney disease, if they're immunosuppressed for whatever reason, so their immune systems aren't functioning normally, and finally, if they currently have cancer, then this category of patients, again, will not qualify for home care. So I think it's easier to understand, or it's easier to actually exclude these categories, and whoever is left behind and fulfills the criteria for mild disease, then you might want to consider treating or caring for them in the home for as long as they are able to implement appropriate infection prevention and control measures, and also close monitoring by a trained healthcare worker can be feasible. So let's talk about that a little bit more in the next few slides. So now that we've decided which category of patient can qualify for home care, we need to look at whether the home setup is appropriate. So before we do that, we need to understand the difference between quarantine and isolation. So we may be using these terms interchangeably, but it's important to understand the difference so that we understand the objectives for what we're doing. Now, isolation is implemented for a person who has already tested positive for COVID-19. So that means you separate that person out into an individual room, and if possible, it should have a separate bathroom, because the objective of this isolation is to prevent this person from spreading the disease to someone else. So the goal is to stay home until at least 10 days have passed, and the patient should also have had no more fever and resolved symptoms for at least 3 days before they are discharged from isolation. So once again, the objective of isolation is so that somebody who has tested positive will no longer spread his disease to other people in the household and the community. And the way to do this is to separate him from the rest of the household, and of course, not to allow him to leave the home. In contrast, quarantine is intended to observe those people who have been in close contact with the positive case for the 14 days over which you expect symptoms to develop. And the reason why we want to do that is because people can be contagious even before they test positive or even before they start having symptoms. And because it's impossible to turn back the clock, then you want to be able to make sure that during those times you may have been contagious already, and you may have started passing on the disease, that your movements are already limited so that you're no longer spreading the infection around. So for those close contacts of a positive case, what you want to happen is for that person to stay home for 14 days since the last contact, and for those people to watch their symptoms, to check their temperatures, and also to stay away from people who are at high risk so that they don't inadvertently infect others who may be at risk. So what are the requirements for home care in terms of a physical setup? We require that people should have a separate room and bathroom so that isolation can be implemented properly. Next, we want to make sure that the room where the patient stays should have good airflow. Next, you want to be able to close the door so you contain the person properly and you contain the airflow, or you direct the airflow properly. And you need to be able to implement a good delivery system for the daily needs of that individual without a lot of contact between the people of the household and those other individuals, or rather the infected individual, the isolated individual. So because our objective is to make sure that whoever is isolated no longer infects the people in his household, it's also important that for any interactions happening between the isolated and the quarantined individuals, that appropriate PPE should be worn. Now, this figure shows us maybe an exaggerated implementation, because in most cases, we only suggest or we only recommend that the carer should be wearing a mask and perhaps a shield without any more outfits. However, if this is available, then this can be helpful as well, so that we try to contain the spread through droplets landing on other parts of the body of the carer. However, as we said earlier, we actually want to select those patients that we provide home care for. And basically what you want to choose are patients who can manage themselves while they're isolated. People who won't need anything more than to be fed, perhaps, and given supplies for the 10 days or so that they are isolated without any need for anybody to provide additional care for them. So hopefully, if you implement home care for people in your family, you actually won't need to even do this, because all you need to do is to leave stuff at the door and they can just pick it up and fend for themselves. But if, for example, you may have some people who need assistance and you need to go into their rooms every once in a while to check on them, then you will need at least a face mask, face shield, and if you have other PPEs available in your home, then that will be helpful as well. Now, as I mentioned earlier, it's very important for people to continue practicing infection prevention and control. And that's one of the critical objectives that needs to be achieved in home care. Aside from making sure that the person who is positive is provided with the appropriate level of intervention, no? So what do we actually advise people who are caring for their family members to practice? First, we want to limit patient movement. You want them to stay in one place and to minimize shared space. For example, if, for example, the person needs to utilize a shared space like a kitchen or a bathroom, that needs to be well ventilated. And after that person has left the area, it's important also to sanitize that area so that whatever droplets might have made their way into that common space, they will be properly addressed. Household members should also avoid entering the room where the patient is located, or if that's not possible, you have to have a distance of at least 1 meter. You also want to limit the number of caregivers. Ideally, only one person is assigned, and this person should be in good health and should not have any underlying chronic conditions. You don't want the caregiver to be the one ending up sick in a couple of days, because that really just compounds the problem. Of course, we know that visitors should not be allowed into the home, and we also know that hand hygiene is very, very important. Additional tips include providing a medical mask to the patient. So the cloth mask probably is not sufficient. You want to be able to contain the secretions more effectively. So whenever these masks are wet or dirty from secretions, you need to replace it right away. And any materials that are used to cover the mouth and nose should be discarded and cleaned appropriately after use. You also want for caregivers to have a medical mask that should cover their nose and mouth whenever they are in the same room as the patient. You also want to avoid direct contact with the patient's body fluids. And of course, we don't recommend reusing medical masks and gloves because they are meant to be disposable and single use. However, if you do use reusable equipment like utility gloves or plastic aprons, then you need to clean them properly and disinfect them. And the recommendation also is you need to clean surfaces, or for example, the bathroom, or you handle linens, you need to be wearing protective equipment. Finally, we want to frequently clean and disinfect surfaces that might come into contact with this positive patient. It goes without saying that the patient's linens and eating utensils should be dedicated for him alone, because we don't want to spread the virus around the household. We want to handle the laundry, the linens in a safe manner, because although virus does not stay very long on inanimate objects, the fact that this person is sick and his body fluids might have infected the linens or the clothing means that you need to handle these items very carefully. You put them in a laundry bag, you don't shake them so you don't aerosolize the virus, and you want to use a regular laundry soap and water to clean them up afterwards. Your utility gloves, for example, garden gloves or any heavy-duty gloves that you might be using to clean up around the house, needs to be cleaned properly as well. And it's also important to dispose of waste very carefully so that we don't inadvertently infect other people who might come across these items, and other types of exposures to contaminated objects in the patient's environment, like toothbrush, utensils, and so on and so forth. We should not be handling these items. Okay, so actually what I've mentioned are stuff that you would not think twice about, no? If this individual who is positive is in the hospital, because you would not have had to deal with the housekeeping considerations for prevention of infection, for prevention and control of infection. Pero kung pipiliin natin na sa bahay natin aalagaan yung may sakit, pati itong mga bagay na to kailangan natin pagtuunan ng pansin. Kasi nga, ang gusto nating maiwasan ay ang paghahawa ng mga magkakasambahay, and also aside from making sure that we provide appropriate care for the individual who is positive. Now, as a starting point, there's some, I came up with a list of suggestions for a home care kit that you might want to have ready in your home. If you're thinking about preparing for caring for somebody in your household who might turn positive from COVID. So I mentioned already, it's very important to isolate the individual and to quarantine those that they are in close contact with. So therefore, to be able to do that properly, you don't just need space, but you also need PPE. When I talk about PPE, it's not just this get-ups na naka-gown or naka-overalls. It's actually inclusive of mask, face shield, gloves, which you might need to stock in the household so that you can prevent transmissions through droplets, which is the most common way by which this virus spreads. You also need to have cleaning and disinfection supplies handy because you want to be able to address any surface contamination. We can use alcohol. Of course, soap and water are still the primary means of cleansing, particularly if your hands are soiled. For surfaces, you might want to use a bleach solution. So for the local brand, you just dilute 45 ml per liter of water, and that should be enough. But they have to be freshly prepared daily because it does evaporate and your concentration might change. So you just prepare enough for the day, discard it, and then prepare another batch for the following day. You will need monitoring supplies. So the objective of monitoring is actually for you to be able to observe trends and to communicate these trends to your healthcare professional. And so it will be helpful to have an organized way of recording the vital signs. You want to put in the date, the time, the heart rate, the respiratory rate, the temperature, the BP, if, for example, you're dealing with somebody who already has hypertension to start with. And of course, if it's possible to measure the oxygen saturation, that will be helpful as well. How many times do you have to do this in a day? In the hospital setting, we typically want to do our monitoring on a per shift basis or every 8 hours. The WHO manual says once a day is fine. So anywhere from once to 3 times a day for a mild case should be more than enough. Then, of course, you want to have medications at hand. The typical medications that we give for fever, cough and colds, and of course, the patient's maintenance medications need to be continued. So the next question we need to answer is, can the caregivers assess the patient appropriately? So this is the third question that the home care guide attempts to answer. And they say it's important to ensure that the patient can be adequately monitored at the home. So what does this require? You need somebody who can be a reliable caregiver. We said earlier that that person cannot be anybody with a risk factor. So it cannot be an elderly person. It cannot be somebody who is already sick. And it has to be somebody who's reliable, so that whenever they relay information to the healthcare professional, the accuracy or the validity of that information exchange can be assured. Now, home-based care, of course, should be provided by a healthcare worker if possible, but we know that in many instances that just cannot happen anymore because of the severe shortage of healthcare workers that's currently happening. Now, if it is a civilian or a layperson who is providing care, then you need to be able to open lines of communication between the caregiver and a trained healthcare worker or public health personnel. This has to be established so that should there be any emergency, the channels of communication are already open. And these channels can be by various means. I know we don't really use email too much to relay health information, but the phones are certainly available. You can use your SMS, you can use your landlines, and so on and so forth, just so long as you're able with a healthcare professional. What is the objective of monitoring? You want to be able to pick up worsening of signs and symptoms at the earliest possible time. And whenever the patient's symptoms become worse from the initial assessment, then this should be an indicator to seek urgent care. So I said earlier, you monitor these regularly, ideally once a day. If you want to do it more frequently, then that should also be okay. But typically, every 8 hours should be fine for mild cases. Now, the CDC has this quick guide for when to seek emergency medical attention. And here is a list of emergency warning signs that you might want to watch out for. First is trouble breathing. So we described this earlier already. This can take the form of an increasing respiratory rate, or it can also be in the form of difficulty speaking. Now, the person might have difficulty forming complete sentences, or is very short of breath, even with just ordinary activities. There can be persistent pain or pressure in the chest, which can also be a sign of difficulty in breathing. There can be new confusion. When you talk to the person, they're not able to answer you properly, they're disoriented, and this is also probably a sign of decreasing oxygen levels in the body. The inability to wake up or stay awake is also a danger sign. Once again, this can be associated with decreasing oxygen levels. And finally, somebody who looks pale or bluish gray needs, of course, immediate attention, because these, again, are signs of decreased oxygen carrying capacity in the body. So I mentioned earlier the need to be able to establish contact with healthcare professionals very early at the start of the illness. So even if you assess your family member to be fairly well and they look like they're going to be able to manage staying at home, you want to be able to establish some kind of contact with healthcare professionals, perhaps your personal physician, or maybe a specialist that your personal physician might recommend, or even these local government units. And the emergency COVID numbers are listed here for everybody's reference. There are also many hospitals now offering home care for COVID cases at home. And I just picked out two of the posters. No, I'm sure you've seen many of them being shared by in various social media platforms. Really just because there's such a big need to answer the question of how do I make sure that my family member is cared for properly. So this is one portal that we can employ or we can use so that at the outset, we have a healthcare professional guiding us in the steps to be able to provide good home care for our family members. Now, how long do you expect for this mild case to last? I just like to show you this timeline of the different disease severities, that we expect, or rather the duration of illness expected from the different disease severities. So we said earlier that we will only choose those individuals with mild disease or even moderate disease without risk factors to qualify for home care. And you expect that they should have symptoms for about 10 days before they start resolving. So what we want to see is that this individual should be improving over the course of this period, because if not, then they may actually be progressing to either severe or critical illness, which then requires hospital-based care. Okay. So with that very brief presentation, I hope I've been able to share with you that the current surge in cases has really severely challenged the healthcare capacity in the NCR and perhaps in many areas in the country. And since the majority of COVID cases are expected to be mild, then home care can be an option for low-risk individuals. I hope I've been able to show you that to qualify for home care, we need to evaluate the following. First, whether or not the patient has risk factors for increased severity, which should prompt us to seek facility care. We need to evaluate the capacity of the home environment, And finally, we need to assess the ability of the caregivers to assess patient status. And only if each of these points are carefully assessed and we see that there is good capability to provide care, should we proceed with the decision to provide home care for our COVID-19 family members. So with that, let me end my presentation and open the floor for your questions. Thank you very much.
Thank you very much, Doctora, for a very enlightening talk. For now, we'd like to prioritize the questions from our social media pages. We have one question from YouTube. May I know the truth? Once you are vaccinated, then you will be COVID positive but asymptomatic?
Okay, so let me frame the answer for that properly. No? The COVID vaccines, there are several types of COVID vaccines. And the ones that are in common use now are the viral vector vaccine, AstraZeneca, and the whole virus vaccine, which is Sinovac. Now, for both of these vaccines, you don't expect the RT-PCR or even the antigen test to turn positive as a result of vaccination. So if you test positive after you get vaccinated, that can only mean that you may have been exposed in the days prior to being vaccinated, so that that explains your positive test result. It's not coming from the vaccination.
All right. We have another question coming in. Can two COVID positive patients be isolated in the same room? And there is another version of that question. What if it is an entire family that tested positive? Can they all isolate in the same room as well?
Okay. So if they are all positive already, then the answer is yes. No. So Poppy, I think I will re-emphasize the point about isolation and quarantine. Dahil magkaiba yung timelines ng dalawa, kaya kailangan maghiwalay. No?
That's right.
So for example, nag-positive ako, ang binibilang sa akin is hanggang kailan ba ako nakakahawa? Up until when can I be considered contagious?
Yeah.
Usually for mild cases or asymptomatic cases, that's a 10-day period. So actually, somebody who turns positive needs to be isolated shorter than somebody who's quarantined. No? So if there's any advantage to being positive, that's it. 10 days tapos ka na. Kasi ang gusto mo namang mangyari is palabasin ka na para kung hindi ka na nakakahawa.
Oh.
Pero yung quarantine, anong inaantay natin? Di ba gusto natin malaman, magkakasakit ka ba? Gaano ba kahaba yung duration ng observation na yon? 14 days. So mas mahaba yung binabantayan natin sa kina-quarantine kaysa dun sa nasa isolate. So yun dun sa kaso na kinukwento mo kanina, di ba? All of them are already positive. So their duration of observation is the same. So they all be together. But if you have a mixed group, no, you have people who are for quarantine, there are people who are for isolation. Pag pinagsama mo sila, paano mo malalaman kung kailan ka magbibilang ng 14 days para dun sa kina-quarantine mo? Walang katapusan yun. So kailangan silang maghiwalay.
Well, then there's a relatively follow-up question somehow. Another question came in. My result of the swab test, RT-PCR, was positive on my day 13 from exposure. Am I experiencing long-haul COVID without knowing? Is this possible, Doctora?
Well, by definition, kasi long-haul COVID is symptomatic. So kung wala siyang simptomas, hindi yan long-haul. I think what we need to realize kasi is that the test has varying pick-up rates. No? I don't want to use the word sensitivity kasi parang nahihirapan tayong intindihin. Pero its ability to pick up a positive varies from day to day. And mapwera na lang kung yung taong yun ay araw-araw nagpa-swab. Di natin alam kung kailan actually siya nag-positive. No?
Yeah.
So in any case, the point is, for that person, kung day 13 na siya nag-positive, so I don't know from what point siya nagbilang diba kung wala siyang symptoms. Yeah. So parang mahirap ma-define yung situation. But anyway, hindi siya long haul kung wala siyang symptoms. And we talk about long haul COVID as being having the symptoms longer than the expected duration. So kanina pinakita natin yung graph no before we ended the talk. So hanggang kailan ba natin in-expect? Mga 21 days even for severe critical. So beyond that, and the person continues to be symptomatic and it's still COVID, then that's when we say long haul yan.
So there really is there's a certain definition when we say long haul
That's
COVID.
Right.
Okay.
That's right.
Here's another question. Is home care better than being in the corridor of a hospital? Or what kind of care do you get in the corridor of a hospital? This is appropriate in our time, Doctora, because as we both know naman, all of the hospitals are piling up and they can't really accommodate all these patients. So what would be most advisable for people in this predicament?
So well, I would say it depends on what the patient is experiencing. No? Kung ikaw ay mild or asymptomatic, I would say na mas maganda pang nasa bahay ka. Pero kung moderate, severe, or critical, ano naman ang maitutulong sa'yo ng mga tao sa bahay, di ba? Siyempre, kahit papano kung nasa ospital ka, kahit nasa corridor ka, may healthcare worker doon na pwedeng tumulong sa'yo. So it's really very dependent on what your medical situation is. And for those people who really need facility care, I would say even being in the corridor of the hospital is better than staying home because you will be able to access those interventions that you need when you're in the healthcare facility.
Here's another question. My gosh, the social media questions are coming in bit by bit. Is there a restriction of the vaccine for those who are planning to get pregnant?
Okay. So the question can be viewed in two ways. First, will it affect fertility? No? And then second, will it affect the baby if in case you do become pregnant? So maybe we should answer it in those two perspectives. No? So there's currently the vaccines that we have in use are all inactivated, meaning there are dead viruses or particles of the virus. And therefore, there's no way for that particular organism to come back from the dead like Frankenstein, no? And affect a baby if you should become pregnant, no? Right after you become vaccinated. Now, as to whether it is expected to affect fertility, there's also no evidence that that's the case, particularly for those vaccines that we already have a long record of use for. So there are 4 platforms or 4 technologies that are currently employed, out of which 3 already have some record of use or others have very long record of use, and they don't have any impact on fertility. The other one, the mRNA vaccines, used to be a technology that you use for cancer therapies, and once again, no impact on fertility has been observed.
Okay, I'm looking through other questions. Here's another one, which actually correlates to what you were saying about your own COVID kits, home kits at home. You mentioned earlier that since bleach evaporates, we need to prepare just the right amount for the day. If we cover and seal the container, can we store it?
Well, I guess, pwede pa rin naman, ano? Pero, mayroon ba yun? Mag-prepare pang araw-araw. Iniisip ko lang pagka may question ka about yung potency, di ba mas maganda na lang kung araw-araw mo siya ihanda?
Yeah. Tama naman. Here's a debate that's long been wanting to get out. What's your take, though, Doc, on the Ivermectin and Bianhua issue? Are they effective? And are they recommended, more importantly, medically speaking?
Sige, so let me try to answer this in a very neutral way. No? Kasi I know this is a very emotionally charged debate. Kahit mga kamag-anak ko, nagtatalo-talo kami dyan. So, from the scientific standpoint, currently, the recommendatory bodies say that there is not enough evidence for ivermectin as a preventive measure or as a treatment for any severity of COVID. Even if there are scientific publications saying that there is evidence for it, unfortunately, the studies are affected by the fact that they include different kinds of populations, or ivermectin in those trials may have been used together with other interventions. So it's very difficult to isolate and say, the effect is solely due to ivermectin. No? So sa ngayon, the scientific community or the world recommendatory and regulatory bodies are saying, let's try to see whether evidence comes in to support its use. More solid evidence can come in to support its use. And until that time, because of the concerns about toxicity and of course the lack of efficacy, then you don't want to recommend their use for now. Now, let me expand that a little bit further, Poppy, and try to address the underlying concern. I think ivermectin can be a stand-in for anything. It can be BCO, it can be orange juice. Diba? Kung biglang nabalita na orange juice is something that works, I'm sure meron din magiging proponent ng orange juice. No, so para siyang symptom kasi ano bang meron natin? Natatakot kasi tayo eh. We are afraid. We have fear and frustration that we're trying to address by putting faith into something that people say works.
Mm-hmm.
No? So ang problema is, tama ba na magkaroon tayo ng faith dito sa bagay na ito? Eh sinasabi nga na hindi pa pulido yung evidence. So kung ganoon, di dapat antayin natin magkaroon ng mas magandang evidence bago natin siya pagkatiwalaan. Otherwise, parang nami-misplace nga yung faith natin dun sa particular intervention na yun. Tapos, i-address natin yung fear and frustration. Ano ba gusto natin? Ano ba kinatatakutan natin? Mahawaan, di ba? So, meron bang ibang pwedeng makapigil sa pagkakahawa? Meron. Just utilizing your mask and shield properly and your distancing and your circulation and your time of interaction, if you put that all together, the numbers supporting prevention with proper use of your PPEs is much, much higher than any intervention actually, whether that's ivermectin or even some of the vaccines sa totoo lang.
Interesting take on that. It really boils down to efficacy, no? Here's one, Doc. How reliable is RT-PCR? Because there have been several news reports of false positives with RT-PCR. Parang this has also been another long-standing debate because there was a point in time it was either RT-PCR antigen and whatever else tests that were made available.
So the RT-PCR, as with any test, will be affected by the patient group that you use it in and the time point over which you apply the test. So the performance of the RT-PCR is best for individuals who already have symptoms.
Okay.
Because basically what you're trying to do is to pick up the virus particles that are present in somebody who has symptoms of COVID. So syempre, you expect to get a lot of it in somebody who's sick. Now, for people who don't have symptoms, then of course the pickup rate is going to be lower. For the people who are close contacts of somebody who is positive, then you expect the pickup rate to be slightly better than somebody who's totally asymptomatic. No? So depende dun sa population kung saan mo siya ginagamit at kung kailan mo siya gagawin. So kunwari, we're talking about somebody who is a close contact of a positive person. You don't go ahead and test that close contact right away. You have to wait. You have to give the viruses a little bit of time to reproduce in that person's body. So we typically recommend you wait on the 5th day after exposure before you do the test. But even then, there is still a false negative rate. Hindi yan totally magpa-positive. So yung tanong mo, false positive rate, pwede rin yun. No? Kasi kung na-mishandle yung specimen or dun sa laboratory nagkaroon ng contamination, pwede siyang mag-false positive. Pero with the quality control measures that we have, that doesn't really happen very, very often.
Yeah. Doc, here's somebody correlated her household situation. One of her staff went on a 2-month vacation and came back April 5. So naturally, the household told her to undergo tests. So she did. The results came in as follows. March 29, her swab test was negative. April 4, her swab test was also negative. April 9, her antibodies blood test was positive. and April 10, her swab test was negative. Now, this person never had any symptoms, so she had a PCR today after after another negative swab result this morning. What does this mean? Does this mean she's COVID positive, or does this mean she was infected or recovered, or how is this defined?
Maybe we should clarify bakit iba kaya yung pagkakastate ng swab at saka nung PCR. So that's a little confusing to me. Pero siguro let's try to address it in a more general manner. No?
Yeah.
Kung may isang tao na nanggaling outside of a household and we're expecting this person to join our household, the safest thing actually to do is to have that person quarantine for 14 days. Kasi kung wala siyang simptomas, di ba sabi natin kanina, the likelihood of this person being totally asymptomatic or totally negative is quite high, and we can't expect the PCR to be fully reliable with a negative result. So the only way you will know that that person is really negative is if you observe them for 14 days and they never develop a symptom.
Mm-hmm.
Okay? So, pero ang hirap ng 14 days, I guess, kaya nagre-rely dun sa test, no?
And this household help wants to go back na daw to work, pero as per the bosses, she's still in a quarantine place now until they're making sure that she wants to.
Correct.
It has to be safe.
You're right. So kung gano'n na lang din naman ang gagawin, kung magka-quarantine na lang ng 14 days, you don't really need to do the tests anymore because the quarantine is far superior to any test. Kasi sa quarantine, makikita mo, hindi siya nag-symptoms over the 14 days.
Yeah.
Pagka mag-test ka kasi, and let's say, at any point in time, nag-negative yun, pwede ko pang sabihin, kasi di ako sigurado kung tama yung timing ko ng test. Kaya reliable yung negative result, no?
Mm-hmm.
Ngayon, yung antibody positive result dun sa taong yun actually indicates, so assuming na lang na we're using a reliable antibody test, so may debate pa rin dyan, no?
Yes.
Kasi pwedeng magkaroon ng cross-reactivity. So it's a technical term. Marami kasing coronavirus, may 7. No? Tapos, yung mga, particularly yung rapid antibody test, pwede yung maging false positive, detecting other coronaviruses, not SARS-CoV-2. So, assuming na lang na accurate yung antibody test na ginamit dito sa taong to, actually, ibig sabihin nagkaroon na siya ng infection in the past.
Yeah.
So, hindi na dapat siya ulit mahawaan at least within the 90-day period, and hindi na dapat din siya magkaroon ng sintomas. So that would be the interpretation I would have. But then, since we know there is a phenomenon called reinfection, ang gagawin ko pa rin, kung ako tong household na apektado, sasabihin ko, hindi, mag-quarantine ka na lang ng 14 days, hindi na kita iti-test, tignan na lang kita. Tapos pag okay ka na, pasok ka na ulit sa atin. Mas madali yun, mas simple pa. Poppy, you're on mute.
Sorry. So I guess, Doctora, that's part of that's I guess answering part and parcel of another question that just came in. Somebody's asking if it makes sense to make their whole household and undergo an antigen test every 14 days, even if nobody has symptoms.
Iniisip ko kasi parang magwo-work lang yun kung walang lalabas sa kanila. Diba? Kasi paano mo malalaman at any point in time kung kailan sila nagkaroon ng encounter with a positive case. And then also, maybe one thing to think about is antigen test sensitivity is also not very high for asymptomatic individuals. It's only, it picks up cases better if you're using the test on people with symptoms already. For those who are asymptomatic, it doesn't pick up very well.
Okay. Here's another question, Doc. If you have been vaccinated with the first dose of your vaccine, regardless whatever brand, I'm presuming, then you tested positive in between the first dose
Two
and the second
doses.
dose. Do you continue with the second dose?
Yes, the answer to that is yes, no?
Still yes.
Because you can only be assured of the published efficacy of that vaccine if you complete the two-dose series. Now, the current recommendation is if you get sick after your first vaccine, then for so long as by the time you get to the second dose, you're fully recovered, then you may follow that schedule. Now, if we're talking about somebody who is asymptomatic but tested positive, you have to wait 14 days because we don't want you inadvertently infecting the other people in the vaccination center or even the vaccinator. So we want you to be at least 14 days from the time of the test before you receive your second dose for
Okay.
asymptomatic individuals.
Mm. Doc, I'm sorry we have to divert again to the ivermectin issue. Not naman necessarily ivermectin, but there's a question that came in. The World Health Organization is against remdesivir. Why is it being used here in the Philippines? Somehow back to the ivermectin debate also, because I think remdesivir is also part of one of those medicines that are, being contested.
So remdesivir, we have to be very careful about how we read the data. Remdesivir, the WHO statement about remdesivir says or refers to very specific, for very specific endpoints, no? And for moderate to severe disease, there is impact on shortening hospital stay. So that's the indication or the reason why it is still being used in clinical practice in many parts of the world. No?
That's right.
So for the specific endpoint that WHO is referring to, they'll say it's not helpful. Pero for other endpoints, may benefit siya, kaya ginagamit natin siya. Versus, if we want to extend that argument to ivermectin, walang evidence for any of the endpoints that have been stated. Poppy, you're on mute again.
I'm back. Yeah, I was just saying, we're waiting pa naman kasi for further studies on all those medicines. Pero I think it's most advisable pa rin to get the vaccines on hand. Here's another question.
So if I may pick up on that point, Poppy, I started the talk off on by discussing the current surge, no?
Yes.
And I think that becomes even more important as a consideration because you will never know when you're going to be infected. With the number of cases now, it's very likely that you may be meeting people who are positive without you knowing it. No?
Mm-hmm.
And even if you're very careful about your contacts, even if you're OC about wearing your mask and shield and distancing and all that, having the vaccine, it's an extra layer of protection that will be very, very helpful now that we are hearing of so many people getting sick. And, I keep telling my relatives, I will be really saddened if ngayon ko pa mabalitaan na magkakasakit kayo kung kailan may bakuna na. Diba? Kasi parang abot kamay mo na yun eh. Pwede mo na sana siyang nakuha, lalo na kung ikaw ay elderly or meron kang comorbidities, you qualify to be vaccinated now. And this is actually the perfect time to be vaccinated because there's so many other people who are infected and you want to be protected.
Mm-hmm. Well, going on the topic of the surge, Doc, here's something. With the surge of COVID and lack of hospital beds, people have started to buy their own oxygen tanks and oximeters. They would like to know how they can use it, assuming one of them experiences shortness of breath.
So yun na nga yung problem, no? Kaya kailangan meron talaga tayong contact with a healthcare professional.
Yeah.
Kasi yung paggamit ng oxygen, although parang iisipin mo, napakasimpleng bagay naman yan, kaya ko naman siguro. Pero tinatitrate din or sineset yung levels kung saan dapat siya gamitin. And then tinitignan din yung condition ng patient. Kasi kung kunwari meron siyang ibang mga sakit, then your targets for oxygen saturation can be different, no? So if you have the capacity to set aside the tank and have the full setup at home, I think it's something that you might want to consider, but I would not use it without the guidance of a health professional because the intervention needs to be individualized.
Yeah. Here are a couple of questions, Doc, regarding vaccination. Who cannot get vaccinated? Second question is, how long after being COVID positive or after recovery can one get vaccinated? And 3, if someone gets COVID after vaccine, although this was answered na rin naman kanina, if someone gets better after vaccination, can he still get vaccinated again? And does the process need to be repeated again? Na 2 doses each. I think this was answered already kanina in another question, similar. But here's another follow-up to that is, what's your take on AstraZeneca being safe for only people under 60 years old?
Okay, so Poppy, you'll have to remind me that's like 5 questions sunod-sunod. Baka mawala ako. Okay.
We'll proceed with the first question. Who cannot get vaccinated?
Sige. So the one that I can remember first off is who will not qualify, no,
Who will
for
not
vaccination.
qualify, cannot get vaccinated.
So there's only one absolute contraindication. The only bawal, no, for vaccination is if you develop a severe allergy to the first dose of the vaccine. That's the only absolute contraindication.
Okay.
Which means, no, everybody qualifies, di ba? Kasi hindi pa naman marami sa atin na nakakapag-first dose. So when we talk about allergies, this is not just yung mga kate-kate or konting rash. We're talking about allergies that cause you to have difficulty of breathing, which is anaphylaxis. Now, that happens in 1 per 100,000. So it's quite a rare event. No? Now, in the past, if you have had allergies to polyethylene glycol or polysorbate, which are components of other vaccines and medications, and also for some medications that are used for colonoscopy, then you also do not qualify to receive the vaccine. But it's a very specific allergy. I'm sure pag na-experience mo yan in the past, naabisuhan ka na ng doctor mo na bawal ka na ng mga polysorbate or polyethylene glycol, PEGs. No? So, very small population of people who will never qualify to be vaccinated. That means most of us, if we're up and about, if we are able to work, if we are able to take care of ourselves on a daily basis, even if we have diabetes, we're dialyzing, we have medications, we are asthmatic, we have some allergies, we qualify to be vaccinated. Yeah. And you actually want to target this group because they're the ones who will probably get moderate, severe, or critical COVID if they do get sick.
A little follow-up to that.
Go ahead.
Kung cancer patients daw, pwede rin, qualified also.
Okay. So this one, you will need to consult your doctors about this because it depends on what stage of treatment you're in. If you are, for example, already several years post-treatment and you're already back to your usual self, then of course, no, you can be vaccinated. Yeah. However, for those people naman who are still just starting their treatments, they may be advised to wait for a better timing. So well, most of the time naman ng mga cancer patients, they're under very close supervision by their doctors. So I would advise, dapat meron silang consultation.
Okay. How long after being COVID positive or after recovery can one get vaccinated?
Okay. So the short answer to that is once fully recovered, you can proceed.
Once fully recovered,
yes.
Pwede na. Okay. Here is, okay. If somebody is taking Ivermectin now, can they take the vaccine as well? How long should they refrain from taking Ivermectin before taking the vaccine?
In general, no, medications don't have any impact on the timing of vaccination. So whether that's Ivermectin or any other medication, you may proceed.
Regardless of medication.
Yeah. Well, the only thing maybe, no, that you would need to flag the vaccinator about would be if you were taking aspirin or some blood thinners, because that may cause a little more bleeding than usual at the injection site. So you need to flag your vaccinator so that they can either choose to use a smaller needle or monitor you properly so that there's no excessive bleeding. Pero you don't expect naman na parang gripo, turok lang naman yun di ba?
Yeah, that's right. Here's another question. The protocol is not to get a PCR test after the 14-day quarantine for COVID positive patients. What is the assurance that the patient is no longer contagious?
Okay. So this is coming out from the fact that after developing the infection, you may continue to be positive for up to 90 days from the initial positive test.
Mhm.
But for those subsets of patients that have been studied and for whom sequential viral cultures were done, no one was detected to be contagious more than 10 days after developing the disease, if this was about a mild case. No? For severe disease, we extend the consideration for contagiousness to about 21 days. Pero usually such categories of patients take a long time to be discharged anyway. So by the time they leave the hospital, they're usually non-infectious already. So for the regular run-of-the-mill patient, it doesn't make sense to keep on testing because you will probably keep on testing positive without being contagious.
Yeah.
So you will be unnecessarily confined when in fact you are allowed to be discharged and to move about freely.
Okay. Here's something regarding Sinovac. Would the Philippine Medical Association recommend this? And why are there no studies published about Sinovac?
Okay. Well, the vaccines, are being recommended recommended for use not by private medical societies, but rather by our government vaccine expert panels. So they're actually 6 vaccine teams that are looking at different aspects of vaccine safety and efficacy. And before anything gets into the program, these different panels will have made an assessment to make sure that the products are safe and efficacious before they are included for distribution to our population. Now, in particular, Sinovac has phase 1 and phase 2 trials that are published, but these are considered to be smaller databases. And what we want sana is for a phase 3 trial to be published already. Now, in the absence of a phase 3 trial, what the FDA and other global FDAs have accepted are reports from the manufacturers so that these can be reviewed and evaluated as a basis for granting an emergency use authorization. So that's what happened for Sinovac. Of course, we still want a publication because this is considered to be the gold standard for reliability. But in the current context where there's an emergency and a shortage of vaccines, we want to be able to access whatever products can be in the market so that we can benefit from it and use it particularly to try to contain the surge. Imagine if we didn't have vaccines and we had to deal with 12,000 cases a day, di ba? Ano na mangyayari sa atin yan?
Yeah, that's it. With regards to vaccines again, is it possible to get 2 doses of different brands of vaccines?
So there's no data supporting that, Poppy. Right now, the recommendation is if you start off with one brand, you complete with the second brand. And I'm remembering that other question that you raised in that series kanina, yung kung natapos mo na, then you get another series, bawal din yun. Well, walang data. So walang nagsasabi na pag tinapos mo na, for example, 2 Sinovac, a couple of months from now, you take another 2 AstraZeneca, and that will be helpful. There's no data to support that.
Well, let's go more in-depth into that talk because this is a bit brand specific. For those who have already taken the first dose of Astra, now that the vaccines have been withdrawn from use, what should be the next course of action?
Okay, so this is a temporary suspension.
Yeah.
Okay, we're expecting to be, so we're actually at a very good point in time, if I should say so. First, the fact that we have a suspension for the distribution or administration of this product should tell us that our system works. Diba? Because otherwise, dire-diretso lang yan. So you have your regulatory authority telling you, wait lang, we want to see this data again. We want to review it because there's so many reports. We just want to be very, very sure. So ano ba naman ang masama to stop it muna? Pangalawa, the people who received the first dose are not due for their second dose until 12 weeks after. So the earliest batch will probably be receiving this March, April, May, June. 2 buwan pa bago natin sila kailangan turukan ulit. And by that time, I'm sure that we will already have had a decision about whether the second dose needs to be continued or not. And of course, I'm sure those people who received the first dose will be happier if they have data to support that they can receive the second dose. Or if not, then what can they expect in terms of protection from dose 1?
Okay. Sorry, Doctor. I think Poppy got cut.
Yeah, right. So I think
Yeah,
it's
so
a cut off.
yeah, I'll take over. So, Doctor, we have a question here. If I'm exposed to a COVID positive patient and it takes time for the virus to grow on me, what can I do to prevent it?
In the meantime, after exposure.
Yeah, after exposure, parang preventive na. Before she gets tested after 14 days, diba? While she's on quarantine.
Well, actually, you don't test after 14 days. You have to test by day 5 after exposure. No? Pero, well, actually, wala. No? Kasi wala naman talagang proven na pag nag-supplement ka ng ganito, nag-megadose ka ng ganyan, it will prevent the virus from growing.
So there's nothing.
There's nothing. Well, there's nothing that has evidence, solid evidence for it.
Would the use of a throat spray, no salinity spray, or a gargle wash like betadine help prevent COVID from entering your nose and mouth?
So there are small studies saying that these topical disinfectants might help. But the thing kasi with topical agents is that it's kind of difficult to establish how long they actually stay on the surface of the nasal passages and the oral passages where you expect the virus to come in. So, yun yung medyo drawback ng topical agents na yon. Pero it makes sense na pwede siyang mangyari. Maybe what I would like to see is gaano ba talaga katagal yung effect nung applied na yon, ng substance na yon, para alam natin kung ano yung basis ng recommendations for frequency of use.
Okay, thank you. So Dr. another question. If someone is found to be COVID positive and is isolated and has already been in isolation for 14 days, is he still contagious?
So sabi nga natin kanina, no,
Hi, Dr. You're on mute.
Yeah, okay. So people who have tested positive are no longer considered contagious 10 days after onset of symptoms or positive test. And in addition, for those people who have symptoms, they're no longer considered, you have to add 3 days na wala silang symptoms before you release them from isolation. So again, for those with symptoms, it's 10 days plus 3 days without symptoms. For those who are asymptomatic, you just count 10 days from the test date.
Okay.
But maybe I should add also, no, for greater clarity, the local regulations just use 14 to harmonize everybody, so it's not confusing. So whether it's quarantine or isolation, everybody just uses 14 days para tapos na wala na masyadong iniisip, di ba? Mas simple. It's less confusing.
Here's another question. It's more regarding the DOH. So a lot of people have low trust in health experts, especially the DOH, and surveys prove that we have low vaccine acceptance. What should the medical community do to improve vaccine acceptance? I think this is even applicable to those people who are unaware of the benefits of having everyone vaccinated.
You know, maybe I'd like to turn the question around and ask, what do you think we should do? Diba? Kasi it's a big problem. and the science is there to support the use of vaccinations as a way out of this pandemic. But people have different reasons for not wanting to take vaccines. I'd like to ask that person, what do you think we should be doing? Because why is it that there's low trust? What particular issues are there that need to be addressed? There are people who are hesitant about vaccines because they don't know enough about it. So you address knowledge, but trust is a more difficult thing to establish. And I hope that um, by seeing all the effort that's being put into this and trying to contain this, some measure of trust can be regained so that people will once again access those interventions that we know and are proven to be helpful.
What would be the implication if, at what percentage probably of people getting vaccinated would we be able to say that we're in a safe zone?
So that's actually a question of what are we targeting to achieve herd immunity?
Yes.
The herd immunity threshold. So based on numbers that were being shared earlier in the game, mga 70% yung target, 70% of the population, and that's quite dependent on the reproduction number for the disease that's operating in a community. So if you have lower rates of disease, your herd immunity threshold is actually also lower. Kaya nga, gusto sana natin, while we're waiting for vaccines to be even more widely available, we want our disease rates to also be lower so we don't have to vaccinate a huge number of people to get herd immunity. But with the current situation, it's going to be even more challenging. Diba? Dumadami yung kaso eh. So tataas din dapat yung kailangan natin vaccinated population.
Okay. And another question, Doctora. Since a lot of us, since a lot of COVID patients are also some are asymptomatic, what would you recommend for? Is it recommended to take regular tests? Like for example, if we have the drivers or helpers, when we ask them to go on errands, would you recommend regular testing for them?
So once again kasi, this goes back to what do we expect the test to be doing? The tests have limited sensitivity, meaning the rate at which they pick up a true positive is also affected by the group in which you do the test. So rather than testing regularly, which is basically a hit or miss operation, you would rather that the people who go out of the house should be consistent in using their personal protective equipment, their masks and shields, and making sure that they're distanced properly and so on and so forth. No? And you also want to be quite vigilant about when they start presenting with symptoms. Because if you put those two together, that's probably a better gauge of whether somebody needs to be isolated rather than testing. Because if your sensitivity of your test is in the 50%, it's kind of like tossing a coin. That result that you have is only reliable half the time. And even if that was negative, it doesn't really tell you anything.
Would you recommend steaming as a preventive method?
That's not proven to be helpful and can actually damage the lining of your mucosa, which can predispose you to even more infections.
Okay. There's so many questions you have to choose. For those who are fully vaccinated, what should they expect? Are they still required to wear a mask and other prevent PPEs after?
Yes, the answer there is yes, because the efficacies for the vaccines are for prevention of moderate, severe, or critical disease. It is not an efficacy that tells us we will not be infected or that we will not infect others. That particular endpoint or result is not yet available from the current data. So what we have at hand is efficacy that says so and so percent in preventing moderate disease or severe disease. And so because we don't know whether these vaccines are able to prevent infection or transmission of infection, we still want to continue using our personal protective equipment.
Yes, I agree with that, Doctora. So I think a lot of people are concerned, people who have comorbidities or pre-existing conditions. Are there specific diseases when you're not allowed to take the vaccine?
The short answer again is no. No? Kasi nga, it is precisely people with coexisting or pre-existing diseases who will benefit from vaccination because they're the ones who are most likely to develop severe or critical disease if they do become infected. So the question lang is, what medical state should you be at to be able to receive a vaccine? So typically, if you are functional on a daily basis, then you are allowed to be vaccinated because that means you are medically stable or you have a stable comorbidity which allows you to be vaccinated.
If you're taking regular medication, are you supposed to stop any of those?
Just for vaccination, you mean?
Yeah, like maintenance medicine?
No naman.
No. And as a more specific question, I am allergic to the dye of a CT scan and anything related with dyes. And I get delayed reaction. Can this create a problem when I get vaccinated?
So yan, very specific yan. And that person, I would suggest allergist consult for advice regarding vaccination and how to manage, or how this person should be observed at the vaccination center.
Okay. Just to interrupt, before, for those watching through Facebook and YouTube, you might get cut soon, but we're recording this presentation, so you can watch us because we'll be having the mass. We have to live stream for our 6 p.m. mass. Yeah, so we'll be recording this and we'll also be uploading it on our Facebook and YouTube pages after. Okay, so I guess that's all for now. Maybe call on Rose, or
I'm here.
Okay.
Okay.
Yeah.
On behalf
Any
of-
questions also?
Oh, are there other questions? Were we able to read all the questions already?
Rose,
Yes.
yeah, I've been looking at the Facebook comments, and there's a request for a part 2.
We'll have to ask
That
Dr.
depends on Doctora.
Yeah, Doctora, there's been a request for a part 2.
Nako, how can I say no? Laki ng utang namin, ang laki ng utang na loob namin sa inyo.
We are very touched, Doctora, and you're giving the PGH Ministry more motivation to continue our outreach to your hospital. Rest assured. Okay.
Thank you.
Well,
It's really
well,
much appreciated. You don't know, parang when I told the alumni that we're doing this webinar, they all said, please send our regards to them kasi talagang kayo ang partners namin sa pag-aalaga ng mga pasyente namin. Thank you.
Thank you. Thank you also, Doctora. On behalf of Santuario de San Antonio Parish and all our listeners here today, we would like to thank you, Doctora Anal Ong Lim, for sharing your thoughts, experiences, expertise regarding this most important topic, which greatly affects all of us now. Actually, with the alarming spike of COVID-19 cases, the concerns for our frontliners, and this scary pandemic outbreak that's evolving into so many variants, and the possibility of being faced with the lack of hospital beds, Doctora, your talk on home care for our loved ones with low risk suspected or confirmed COVID-19 infection is really very timely. and relevant. So thank you so much for preparing such a rich and informative talk. Your advice on how we can prevent the spread of infection and protect ourselves in our homes as we support and care for our loved ones while in quarantine or isolation is especially useful, as well as your suggestions on what we would need to prepare for our home care kit, how we can do proper monitoring and the danger signs to watch out for. This talk has really enabled us to get a lot of tips on how to provide good home care for our family as well as how to protect ourselves now. Dr. Anna Ong Lim, again, we'd like to thank you for taking the time to prepare such an informative presentation. You are doing a great service for our country, and we continue to pray for you and all our frontliners. We can really never thank you enough. We would also like to thank our listeners for joining us today and for being very participative. Your questions and comments have really allowed us to learn from one another. And I guess before we end, I'd like to comment on or take the challenge of Dr. Anna when she posed the question, what do you think we should do? Because during this time, we cannot just rely on our frontliners and government to look for solutions. The solution is really in each and every one of us. And let's continue to be informed and to inform. And with that, good afternoon, everyone. Good evening. Take good care of yourself. We continue to pray for each other and stay safe and well. God bless.